Hello, everyone. First of all, thank you, IAGV, for giving me the opportunity to present this topic of advanced bipolar and vessel sealers. This is my disclosure. I have no conflict of interest. So we'll first begin with what is the basis of advanced bipolars. The main difference between our usual bipolars and the advanced bipolars is that advanced bipolars use adaptive tissue technology. Now, what is adaptive tissue technology? It is basically using an automated tissue feedback response system. What does that mean? That is, there is a computerized program in the generator and the processor which senses the impedance and measures the impedance constantly, continuously, and readjusts the voltage and current according to the impedance. And the same impedance measurement will tell you whether the vessel has completely sealed or not when the current transfer has ended. Now, the delivery of the electrical transfer can be pulsed or continuous, but the main feature of advanced bipolar is this computer controlled high frequency adjustment of voltage and current. Now, what does vessel sealing mean? What is the mechanism of vessel sealing? Now, if you go to the basics of vessel sealing, it means that it is a combination of the pressure applied by the jaws of the bipolar device plus energy. And what this results is that, and of course, when you are using an advanced bipolar, there is this tissue impedance feedback, which is at least more than 3,000 times per second. Okay, it can be more also. This is the basic definition. And this leads to denaturation of collagen and elastin, resulting in the complete fusion of the vessel walls, so that two vessel walls are also coapted and interlinking proteins are denatured and combined together to form a single seal. And this unique combination of pressure and energy is used to fuse the vessels and lymphatics, including up to vessels up to 7 millimeter diameter tissue bundles, and there is no use of sutures, staples, or clips in these devices. Okay, so this is the vessel sealing mechanism. Now, just to give you an example, how LigaSure works is what they have described is that electrical energy is pulsatile, reducing the thermal spread up to 1 millimeter. That is what the official website says. Impedance feedback is there, and this keeps changing as the device advances. The impedance feedback rate increases. Seal cycle is 2 to 4 seconds, and it has one more feature, that is retractile blade for cutting. This can be feature of, and this is how with the heat and pressure the collagen is denatured and elastin is denatured and a vessel seal is formed. So what is advanced bipolar? It is vessel sealing technology plus inbuilt cutting mechanism. No need of additional instrument cutting for cutting, and the generator indicates the completion of seal cycle with the impedance feedback loop, and the surgeon can then proceed with cutting. Now, here are just examples of what all devices are available. You can have any of these devices, and I think most of these devices are available in India. LigaSure is from Medtronic, NSeal is from J&J, Gyrus is from Olympus, Marcel is from KLS Martin, Voyant is from Applied Medical, CoolSeal is from Hologic, LigaPro is by Winglobe, I think it's an Indian company, and Thunderbeat is again from Olympus. Okay, now there are various devices. You can choose any one of them, and they qualify more or less in the definition of advanced bipolar. Just to share as an example how this device works, what is the sequence of working with, let's say, LigaSure, you grasp the tissue to seal with proper pressure, activate the energy, and continue pressing. And this continuation of pressing is helped by a lock system, which is inbuilt. Generator automatically controls the energy delivery. Wait for the double beep end tone signaling for seal complete. activate the cutting blade after that to divide the tissue, and then open the jaws to release. So this is what is the usual sequence goes. Okay, and there can be variations to this depending on what type of device, which company device you are using. But the most important thing is what are the usage tips that company has given, and also some usage tips which I will give you from personal experience. One is no isolation of vascular structures is needed. This is what the company says, but I think some degree of skeletonization is better. That is my opinion. Retaining some amount of adventitia above the vessels is important to gain more collagen for a better seal. Now, avoid tension on the tissues when sealing, because that will change the dynamics of the tissue. And then that is not the ideal way to seal. So that is very important. Recognize and re-grasp the alerts uh, with 4 short beeps, and keep the electrodes clean. Clean, you can use moist gauze. This is important for proper energy delivery, and it also helps in preventing sticking, because if there is some blood, which is charred blood, which is there on the device, then it may not function in an optimal way. And do not overfill the jaw. That is, your grasp should be less than the length of the jaw, grasp of the tissue. Okay, that is what is meaning, what is the meaning of not overfilling the jaws. Okay, now this is just an animation of how advanced bipolar works. Now, for example, here we are seeing ligashore. Your first thing is you clamp the tissue with, you apply the pressure, you maintain the pressure, and then the generator will deliver the energy, of course, with the signal of the surgeon. And then you, when the beeps come around of vessel seal, that is when you cut the tissue. Same goes with this device and seal. Now, all these companies will use different terms to describe their working mechanism, but in the end, it is the same thing, that it is a combination of pressure and energy and an active feedback loop giving information that the tissue has been sealed and all the proteins have been denatured and the vessel has been sealed. Okay, so the basic functioning and the basic idea is same. Only now there are these newer devices, for example like Thunderbeat, which use combination of two technologies, that is ultrasonic, which I think will be presented in detail in the next presentation, and the vessel sealing technology. So this particular device has got and combination and simultaneous use of these two technologies, ultrasonic as well as vessel sealing bipolar technology. So that is very interesting, and it can have, I don't have any personal experience of use of Thunderbeat, but I think those who have can highlight more on during discussion. Now, this is how I use advanced bipolar. I do a lot of vaginal node surgeries, which is endoscopic vaginal surgeries, and particularly advanced bipolars with inbuilt cutting mechanism are very helpful in such surgeries, because you don't have to exchange instruments, and with one single device you can complete your entire surgery and it is especially very good for hysterectomy. Like you can see here, you can also observe all the pedicles that I have sealed, and you can visually understand the quality of seal and the way you are using the device. All you have to do is uh, grasp the tissue, don't overfill the jaw, apply pressure, wait for the seal cycle, and then cut. And just keep away from all the important structures. So the safety margin is very important. Always have more safety margin than what the company claims. That is the basic idea. Now, there are different terms which different companies will use, and the basic effect is very synonymous. Okay, like for example, Olympus, Gyrus, PK, they will explain you in terms of vapor. A vapor zone is formed, and the current passes around the vapor zone, and vapor zone collapses, and the tissue sealing occurs. So many companies will come out with different terms, but these are basically synonymous. And if you see the end effect on the tissue, it is basically the same thing, that is a combination of pressure and energy. And the basic functioning of advanced bipolar is by utilization of impedance measurement to understand the seal has completed or not. And that is the completion of seal cycle. So don't get confused with various terminologies that companies use. But some companies may have definitely different things. They bring something different on the table. For example, Thunderbeat, it is a single device with two technologies. Now, ultrasonic is something uh, which is called the frictional heat generation because of high oscillations of the ultrasonic probe. And plus this, I think Dr. Sanket sir will talk more about that in detail in next presentation. I will not focus on that. Plus, it is in Thunderbeat, you combine it with vessel sealing. And in this diagram, you can see that how ultrasonic probe is also a bipolar electrode, and how both these technologies are fused together and they are used simultaneously. And there is the advantage is that there is no cutting blade required. Probably that increases the life of the device. And that is the reason probably why this device has been marketed as a reusable probe, if I'm not wrong. And one more thing which studies have highlighted is that Thunderbeat has, it seems, a high burst pressure compared to other devices. That's what some of the studies say. And plus, every company has their own unique feature in terms of jaw design, with more grip and these things. So you can personally evaluate what is good for you. One may not be necessarily superior to other, but it depends on your situation and your hospital setting, your cost analysis, and any device may be better for you. That is, so my idea is to lay out information about all the devices to you. For example, here you have comparison between Harmonic, Ligashore, and Thunderbeat. Now, some of these charts may be older. These devices keep upgrading and newer generations keep coming. But basically, all these devices are good enough for 5 millimeter. Some companies may claim 7 millimeter vessels also, they can seal well. And that keeps changing with generation. For example, newer generation of Harmonic can seal 7 millimeter probably. Comparison between the cutting speed, Thunderbeat claims to be the highest, fastest cutting effect, and burst pressure is also maximum with Thunderbeat. Uh, but all said and done, all these burst pressure, the most important thing is that if the burst pressure is 3 times more than systolic blood pressure, normal systolic blood pressure, that is, if it is more than 360 millimeters of mercury, it is more than enough. Okay, so anything more than 360 is one and the same thing. So don't decide according to that. Okay, so hemostasis and action, thermal spread, all these are comparative parameters. More or less, all the devices claim to have lateral spread between 1 millimeter to 2 millimeter. And of course, then ergonomic is something which depends on the surgeon experience. You may find one device more ergonomic than other. You might be doing some kind of surgeries which is more suitable for one device than the other. So it depends on your scenario, your practice, the kind of surgeries that you do, the cost at which you do. So all these things have to be taken into account whenever you decide to buy an advanced uh, bipolar or vessel sealing device. And also be wary that different studies highlight different things. One study will say that Ligashore has less thermal spread than Harmonic, and there will be other study which will tell you that Harmonic scalpel has least thermal spread. For example, this one over here. And in terms of burst pressure, Ligashore is highest rated compared to others. And then also there are parameters like smoke and visibility. The least amount of smoke is by Harmonic scalpel. These all things can be debated. Like I think ultrasonic energy produces a different kind of a dust, which is not exactly smoke, but I think they are very tiny tissue freckles. So that also interferes with visibility, and it is not just always about smoke. So this is a very interesting study, which I think is very important pertaining to Indian scenario and many countries where these kind of advanced bipolars, which are marketed officially as a single-use device or as a disposable device, but they are used as reusable device. We know that there is an off-label use, reuse with sterilization, of course. So this particular study looked into what happens when you reuse and re-sterilize these devices in terms of their performance, and they compared Ligashore and Kaimin to MARSEAL. MARSEAL is a reusable advanced bipolar system. So they found out, the good news is that they found out that they achieved burst pressure comparable to those produced by the reusable MARSEAL. But it is important to note that the number of cycles they were used was only 5. So uh, you have to understand all these things, because with reuse, every company will tell you that the coating of the device, the nano coating of the device will go down, the performance of the tissue of the device will go down. It can interfere with the impedance feedback loop measurement, and so forth and so on. So you have to be aware of these things if you are someone who is reusing and re-sterilizing these devices. It is very important to understand the concept of vessel seal strength, because this is what you will be looking at. Ultimately, this is what you want when you are choosing to use a vessel sealer. It depends on many factors: what type of vessel it is, whether it is artery or vein. Arteries have a better seal than vein. Vessel wall thickness, the less than 5 millimeter vessels have a better sealing. Vessel composition, how much is the percentage of elastin, how much is the collagen. For example, with it has been shown in studies that with reduction in the elastin content, there is a increase in the seal strength. Okay. And then blood pressure has also the role. The distance from the vessel origin from bifurcation has a role. The more you go away from the bifurcation or origin, the seal strength increases. Now this is all have been studied in various mainly ex vivo models. So you have to understand that the situations inside the body in vivo may be slightly different. But the good thing is that when considering minimum threshold for the successful seal, it was found that vessels of less than 5 millimeter in outer diameter were shown to have same kind of seal strength irrespective of vessel morphology. So for less than 5 millimeter, you don't have to think about all these variables. For more than 5 millimeter, you have to understand what type of vessel it is, what is the thickness, what is the outer diameter, whether it is artery, whether it is vein. For example, here you can see that as the elastin content decreases, the vessel's seal strength goes on uh, decreasing. Okay, goes on increasing. So with more the collagen, less the elastin, better is the vessel seal. So that explains the difference between vessel seal strength between artery and a vein. Okay, most important thing that everyone is concerned about while using any kind of energy device is lateral thermal spread, and that is not something that you can get away even when you are using an advanced bipolar. Okay, so what are the parameters on which lateral thermal spread depends on is again, this has been studied, and there can be various variables to it. Most important thing is that you have to understand what device technology you are using, what kind of insulation materials they have, what is the quality of the device. Again, whether you are using it for the first time or whether you are reusing it, what is the tissue composition that you are dealing with, what is the percentage of elastin in this tissue, whether it is artery or vein, what is the duration of seal cycle, because one particular company may have a longer seal cycle than other. That is just because of the way they deliver energy, the way they deliver voltage and current, the way they measure impedance feedback. It all depends on that, and that will ultimately determine what is the duration of seal cycle. That may have an effect on the level of temperature, and that may have the effect on the thermal spread. So this has been studied in ex vivo models. Like here they studied MARSEAL, and they measured what is the critical zone. The critical zone is something where the temperature is more than 50 degrees Celsius, which may cause irreversible thermal damage. So anything with up to 50, more than 50 degrees Celsius is a thermal spread that can damage tissues irreversibly. So coming to new updates and newer devices, so many companies are trying to improve these variables and offer you newer ways and more technologies. Like for example, here is an example of Hologic Cool Seal, which is the first device that claims to have less than 1 millimeter thermal spread. Now, of course, all these things are according to what company website says, and you have to understand it may vary depending on what tissue that you use it on. Another example is Buoyant from Applied Medical, which says it has the fastest seal cycle, less than 1 second. Okay, I'm telling you, giving you all these information that every company has its own USP, every device will have its own advantage and may have its own disadvantage as well. The more you research into it, the more you know. There is also, I think this is the only reusable advanced bipolar which is available in Indian market. So Marseal, you should know about this. Uh, and I think this is the device from Bissinger called eCut, and it has a different mechanism of working compared to the other advanced bipolars. It does not have a cutting blade, so the way they have designed the blade is in such a way that it causes coaptation of the vessel walls and vessel sealing and cutting effect at the same time. Now, I'm not sure whether this could be included in the definition of advanced bipolar, and there are similar devices other in India markets called shearers, which have the similar working mechanism, but I'm not sure whether we can include them in the definition of advanced bipolar, because if they are not using the feedback, computerized and controlled feedback loop and impedance measurement to adjust the voltage and current that is delivered to seal the vessels, whether we should include them in advanced bipolar is not, can be a matter of debate. Okay. So now, in the end, I want to conclude with 9 golden tips from my personal experience. This is just a practical guideline. What I have experienced is that vessel sealers are highly effective for vessels up to 5 millimeter outer diameter. You can easily get away with vessel sealing devices with these size vessels. They are moderate to highly effective for vessels up to 7 millimeter outer diameter. Okay, so for 7 millimeter, you should be considerate of what tissues you are dealing with, what type of device, what energy. So all these things are important, and you can increase your performance by sealing at multiple places. So that these are the surgical hacks that you can use, that instead of sealing just at one place, you can seal the vessel at 2 or 3 places. But for that, you need to have a very good dissection. You need to skeletonize in a nice way, not over skeletonize, and also lateralize all the important structures like ureter and bowel away. For more than 7 millimeter size, I would suggest that you should seriously consider suturing, because if you are doing advanced laparoscopy, there is no getting away with suturing. Veins can be difficult to seal. It is the attribute of its tissue composition. So my tip is that don't skeletonize the vein completely. Maintain the surrounding adventitia to gain more collagen in the seal. That will help you. Some degree and not complete skeletonization of arteries help in good seal. Like, I do not agree that you don't have to skeletonize at all. Some degree of dissection is important to identify the vessel, and then keep some adventitia over it for gaining more collagen. Charred tissue, necrosed tissue, or when there is blood, bleeding interfering with your, and on that you are coagulating, that will interfere with the impedance feedback. It will lead to poor sealing, and it will lead to more bleeding, and then you will ultimately land up in more thermal damage. So whenever there is such a situation, you have to go back to basic surgical principles, that you have to first control the bleeding, apply pressure, identify where the bleeding is, identify if you can safely use vessel sealer or not, whether there is safe distance between important structures or not, and then dissect if needed, suture if needed. So these are the things where you should be cautious about using an advanced bipolar. Maintain at least 5 to 6 millimeter distance from the edge of advanced bipolar and any important structures, because most of the companies claim that their lateral spread is either less than 1 millimeter or 1 to 2 millimeter. So it is fairly safe to say that if you keep 5 millimeter distance minimum, at least, from all the important structures between the edge of the bipolar and the important structure, you would be riding in the safe zone. Understanding the vessel sealing devices, their mechanisms, their characteristics, their surface, the tissues, tissue composition and the interaction between the vessel sealing devices and tissues is crucial for effective and safe use. You cannot just say that I have this device from a very good company, less than 1 millimeter lateral spread, I can use it anyhow, anywhere. No, it depends on the what tissue you are applying on, what kind of dissection you have done, what kind of case it is, whether you are dealing with a very complex case where all the important structures are stuck together. So it depends on so many things that what your safety margin is going to be. In future, more research into the surface characteristics of the contact surface with the minimization of thermal spread could lead to an improved seal strength and overall device performance. I think this is what most companies are working on. They're trying to optimize the vessel sealing mechanism, trying to make it faster, trying to reduce the highest temperature required for vessel sealing, and trying to reduce the thermal spread. Thank you so much for your kind attention. If there are any questions, we will take it in the discussion. Thank you.